Thank you very much, Jeff. I think we have time for a couple questions maybe before we move on, if there are comments or questions. One I would make with respect to the issues of the family that you mentioned, which I think are very important. The demography is such that the need for technology to augment the capacity of family members to monitor their older dependent family members is very significantly changing. Not only are people living older and longer, but the total fertility rate is falling, so the number of older dependent people per child is increasing. And the structure of the family is changing. It used to be kind of a linear biological thing. Now it's a kind of horizontal voluntary thing with people moving in and out of the household, living thousands of miles away, much less able to directly influence the care of the older dependent family members, so that if these shifts continue, the technology is going to be a very significant requirement.
I agree with you, Jack. It is. My sister lives in California. I live in Toronto. My mother lives in Cambridge, England.
Right.
But we have to be focused on technologies that are culturally sensitive, because there are still situations where there are multiple generations living in the same accommodation.
Yes.
And when my students go out into the community, I actually deliberately target with the home care workers going into socially deprived environments, because the problems are usually easier to solve in my affluent environment than they are there. So I think, Jack, one of the things I would want to reinforce throughout all of this is that affordability has to be a very big consideration.
Yeah, thank you. And any other comments or questions? Thank you. Yes, please. Yeah. Yes, Lisa.
Hi, thank you for that wonderful presentation. Thank you also for mentioning affordability. At a number of points during your comments, you made some comments about the U.S. healthcare delivery system and their financial system that I will not argue with. But obviously, cost and people's affordability is going to be a really important issue, along with whether the financing system within a particular environment like Cambridge, England, or Canada, or the United States will in fact pay for the technology. So as you're doing the work with all the wonderful young people who are climbing on ice that you're putting them on, and I suspect that Occupational Safety and Health has evaluated your facility for your employees, but I see that you've got little wires to keep them upright.
Oh yeah, safety is a big issue
right.
with us.
Are you also having health economists working with you
yes.
and thinking about, and can you just give us a sense of where some of those economic analyses are going?
Yeah. In fact, we take 3 or 4 projects a year, and we do a formal ROI calculation on them to work out what our research is doing. And you always have to be careful, because the numbers get very big and you can get very enthusiastic. But because we're talking about such large numbers of people, the cost savings from even small interventions tend to be massive. The question is, will the invention ever make it into the real world or not, right? So we spend, and I know a lot of other people in this room do as well, a lot of effort in trying to launch companies and bring companies in and make products available. And we do that all over the place. So I would say, as researchers, our culture has changed. Nowadays, when we write grants, we're talking not about outputs, numbers of papers, numbers of conference, numbers of dollars. We're talking about outcomes, number of people affected, always, number of people affected. As researchers, we're not just trying to get an idea, we have to get that idea into a product. And so that takes up more than half of our time. Yeah. Thank you very much.
Thank you very much. Terrific.